I'm Dr. J. Lionel. I work presently at the Regional Hospital Bamenda. I also the acting coordinator of the hepatitis clinic that is currently taking place at the Regional Hospital Bamenda. We manage people with hepatitis and hepatitis-related complications. So it was a pleasure for me to be a part of this discussion, especially as it concerns the liver too. That NASH, by definition, is simply excess accumulation of fats in the liver with exclusion of secondary causes and alcoholic fatty liver disease. So that is simply the definition of NASH. NASH simply means non-alcoholic steatohepatitis. It's one of the range of conditions that they call non-alcoholic fatty liver disease. You have NASH, you have steatosis, and you also have cirrhosis, and the end stage being cancer. So non-alcoholic steatohepatitis is a condition in which fats accumulate in the liver and is not due to alcohol, not due to drug induced, not due to other comorbidities like Wilson's disease, like hemochromatosis, not due to conditions like alcohol-induced fatty liver disease, and not also due to conditions like toxins. So it simply, by definition, is accumulation of fats in the liver, and that is caused by accumulation of fats in the liver that is not due to alcohol and not also due to other secondary causes. That's what NASH is all about. And it's a condition that can affect all ranges of people. You have risk factors that exposes us to this condition. For example, obesity, for example, excess weight gain, for example, insulin resistance, sedentary lifestyle, increase in dietary fats intake, increase in dietary carbohydrate and fructose intake. So those are some of the risk factors which can expose you to it. Then you also have genetic risk factors. Now, you must also understand that in our dispensation where we are living in Africa, we are currently adopting a Western lifestyle. So this condition is becoming very prevalent in Africa because of our change in lifestyle. A lot of Africans now depend on fast food as their main menus in the day. Some of them depends on car as a way of transportation. They don't have time to exercise. They are not active. They only move from office to house. They are less active. So all these factors predispose you to NASH. A diet that is preventive to developing non-alcoholic liver disease is a diet which has a lot of proteins, less of carbohydrate and free fatty acid, especially the saturated fats. That is the kind of diet which is advisable to prevent this complication and also to even manage it. We are living in a society where most of our patients can't afford for us to be able to do all the investigation to diagnose this condition. That's the first difficulty, financial constraint. The second difficulty is we are living in a situation where there are a lot of comorbidities that we have to exclude. And these comorbidities entails you to do some very invasive tests. For example, you need to do a biopsy of the liver. Very few centers in the region here, maybe just Bingo in the Northwest region, do liver biopsy. So it is actually a limitation because the diagnosis of NASH is by histopathology. Means you have to take a specimen of the liver and they check in the lab to confirm that you have fat deposit in the liver, and you also have ballooning of the fat of the hepatocytes. That's how you have to confirm. So we have a limitation of the technical platform. We also have financial constraint. We also have a lot of comorbidities to exclude. And we also have a population of people who they are not willing to consult. For example, somebody who is obese or who is gaining a lot of weight, is overweight, doesn't see it as a problem unless that person develops a comorbidity that might bring him or her to the hospital. So they always come to the hospital late, maybe when they already have complications. So that is one of the challenges we have. They don't come early so that we can assess and we prevent the end stages of this disease. So those are some of the limitations we have. These cases might be a combination of various factors. Maybe hepatitis B was there, maybe alcohol was there. It's a combination of mixed risk factors. You understand? Yes, that we have. And since we can't do all the tests for us to come to the conclusion of the exact etiology, it becomes very difficult. So we have cases of steatohepatitis from hepatitis B, from that you have other concurrent infections or comorbidities in that. But we have people who are diabetic, who have type 2 diabetes, insulin resistant, which are risk factors to NASH, which if we were able to properly assess them, we can diagnose them for NASH. Of course, it's a public health concern because it concerns the liver, and it affects more than, I found some statistics that more than 25% of the population in US is affected by it. We don't have statistics in Cameroon here, but you must also know that if you look at our population, you have the population of fat people, the proportion of fat people, obese people is increasing. Proportion of people with non-communicable disease like diabetes, high blood is increasing, which if we were able to detailedly assess them, we can diagnose them with NASH. Because we have a proportion of people, the proportion of people who are increasingly become obese, who are increasingly developing type 2 diabetes, who are increasingly developing other metabolic complications which can be joined together with NASH is increasing. So it's a public health concern. Furthermore, the liver is a very vital organ. Very vital. And the liver is affected by a wide range of conditions, including metabolic, circulatory, infectious. For example, metabolic is the NASH we are talking about. So it is a public health concern because the liver is a vital organ, and a lot of people suffer from liver-related diseases. I would like to say that NASH doesn't have any specific management. Okay. There's no specific drug to manage NASH. The first thing with respect to treatment or to manage people who have this condition is the management can be divided into two parts. You have non-pharmacologic and also pharmacologic. Non-pharmacologic has the aspect of lifestyle modification. Lifestyle includes a person has to be active, engaged in regular aerobic sports. Normally the recommendation is that you do at least 150 minutes to 200 minutes of exercise divided into 3 or 5 sessions a week. So you have to engage in regular exercise. Then you also have to eat a healthy diet. A healthy diet is a diet which has less of carbohydrates and fructose, less of free fatty acids, and rich in proteins. You also have to avoid alcohol, especially for people who already have advanced states of it, because, like I said, I listed some conditions which can occur concurrently with NASH. Alcoholic liver disease, they can occur concurrently with the NASH. And when the liver is already injured, the liver is one of the main organs, it's a main organ of detoxification in the system. So when you drink alcohol, it's the liver that is responsible for eliminating it. So when you already have a liver that is sick, you have to avoid anything which is going to pose more insult to the liver. This includes traditional medicine, drugs, unprescribed drugs, toxins, and even alcohol. You have to avoid all this. That is part of the lifestyle modification. And I already mentioned the diet. And most importantly, weight loss. It's very key. Depending on the weight loss has to be modest. Modest weight loss means that you do it gradually. You don't just do abrupt weight loss. And studies have been done and proven that when you lose, the target is to lose more than 7 to 10% of the body weight, because at that range of weight loss, it can reverse not just the inflammation, not just the steatosis, it can also reverse cirrhosis. Cirrhosis is when you already have fibrous tissues at the level of the liver. So when you have up to 7 to 5% of weight loss, it can reverse even the cirrhosis. That is very key in the management of people with NASH. Now, we now come to pharmacological management. Pharmacological management involves managing other comorbidities. For example, people with NASH, they have type 2 diabetes. So you have to give them drugs. They call them insulin sensitizer like metformin. There are some other group of drugs which are used to increase insulin sensitivity, because one of the problems faced with NASH is there is increased insulin resistance, both at the level of the liver, at the level of the fat adipose tissue, and at the level of the muscles. So you give drugs which can increase sensitivity of these organs to to glucose, so that the glucose can be taken into the system and making use of and not being stored as fats. Then if they are hyperlipidemia, because it's usually associated with increase in lipids in the level of the blood, they call it dyslipidemia or hyperlipidemia, you have to give drugs, they call them statins, to reduce the fatty level in blood. And this dyslipidemia also helps to prevent other cardiovascular risk factors, for example, like hypertension, and also prevent stroke or peripheral arterial disease, because people who have NASH and have hypertension, the risk of progressing to end stage is more than 7 times compared to people who don't have hypertension. There are also drugs like vitamin E, which is an antioxidant, because you must understand that what causes the steatosis, that's the inflammation at the level of the liver, is because of cytokines which are released. So vitamin E helps as an antioxidant they give to this patient to help reduce the steatosis and also reduce the release of these cytokines. If the World Health Organization, or they could put aside a day to be able to commemorate a specific day for this particular pathology, it is because it is of paramount importance. And we are having an increasing number of people in our population who have this complication. It might not be diagnosed, they might be living with it undiagnosed, but they only come to the hospital with complications of it. So we have to be aware of a pathology like this. And so when you already start having risk factors like type 2 diabetes, obesity, metabolic syndrome, you have high levels of lipids in blood, you need to come to the hospital so that they can properly assess that this lipids is not also affecting your liver. So it is a very common pathology, and it has very debilitating complications on the population, which we must be aware and prevent it, using both our lifestyle, our diet, as well as also preventing the comorbidities that we already have.
Thank you very much, Doc, for talking to us. We are so grateful.